it goes like this: the fourth, the fifth, the minor fall, the major lift, the baffled king composing hallelujah.
Hello there. It's COVID-19 update by Heerak for November 7th, 2020. It is Saturday. As you know, I'm running as a candidate for U.S. Congress in Virginia's 8th District for November 8th, 2022. So 2 years from now. Yeah, I'm glad to share with you and share my insights and thoughts. A lot is happening in 2020, and a lot more will happen in 2020 before we enter 2021. Today is National Bison Day. Yeah, November 7th, 2020. I've never had bison meat before, I don't think. But I heard it's pretty good. So I want to try it, But, they say it tastes like beef, but a little bit more like rigid. Um, yeah, I don't know. But, I tried alligator meat when I went to Florida with my best buddy Ed and Musang from Philmont Christian Academy. It is pretty good, alligator meat. Like they had alligator burger, you know. I mean, if it's an animal, you could eat it, right? So, yeah. Do you remember like monkey, like brain, eating monkey brain? I guess it was in Indiana Jones and Temple of Doom. It's like a movie. Yeah. Yeah, I remember people talking about that. Yeah, we had like 1,000 people who died in 24 hours, 955 people. COVID-19 death in America is at 237,019. Yeah, it's really sad. Very, very sad. 9,851,718 cases. As you know, I'm predicting that at least 3 million U.S. citizens will die, unfortunately, by May or June 2021. There's no vaccine. There is no cure. Scientifically, it's possible for 3 million Americans to die. Yeah, you should lock yourself in your room or home, socialize just with people in your household. That's the way to survive. But if you're out and about and socializing physically with people, you should not be surprised that you get COVID and die. Unlike what people were saying before, COVID is killing a lot of people. It's killing 1,000 a day right now. And they say it's going to get worse. Yeah, I mean, it takes like 3 to 4 to 5, 6 weeks, to see the spikes in deaths. So that's coming. Um, yeah, I mean, we're 1,000. That's not shabby, right? It's a lot of deaths. But as we head on toward cold flu season, that will spike much higher. So it's going to be sad. Today, President Trump played golf. He's a cool dude. Election has not been called yet, so we don't have a winner in terms of who the president is. Obviously, we should do vote recounts for Pennsylvania, Michigan, Arizona, Georgia, and Wisconsin, just to see what happened. It seems like there are a lot of shady things going on. People sending videos and documentation, eyewitness reports as witnesses of all the shady things, voter fraud. So obviously, the courts are required to look into these matters because it's about justice and fairness. You can't just let the liberals use tricks and shenanigans to claim victory. There's enough documentation and evidence to do a vote recount in all these 5 states, and that must be done. So, as far as I'm concerned, there is no winner. No one has won yet. Um, and you should also respect democracy and democratic process enough to say no one won yet. Um, yeah, so let's do recount and see. What is Joe Biden afraid of? You know what I'm saying? He has something to hide. Tim and Joe have something to hide. Um, yeah, right now, Europe is spiking COVID-19 death, unfortunately. Um, so, yeah, still, Latin America is the continent of death, but Europe may catch up. Look at the numbers, but most of the numbers are from the first, in the beginning, right, in March and April. We still have to see whether they're going to have a lot of death, but most likely they will because right now a lot of people are dying. Um, I, Heerak Christian Kim, candidate for U.S. Congress in Virginia's 8th District, predict that millions of people will die in Europe. So globally, I'm predicting that 100 million people will die by June because there is no vaccine, there is no cure.
Hello, I am David Jeremiah. Thank you for joining me for this very special presentation of Forward. Today,
I like that guy, Jeremiah. He seems like a nice guy. Um, but the world seems like we're going to have a lot of COVID death because we don't have a vaccine, we don't have a cure. So I'm predicting that there will be 100 million people who die by June. Obviously, I don't want anyone to die. I want everybody to live. But it seems like a lot of people are going to die. I mean, we have 1,000 dying every day in America right now, and we're entering the flu season. So, we're in the beginning part of the flu season. Um, so you can imagine how many people are going to die at the height of the flu season. I'm predicting that we're going to have like over 10,000 people die every day, like in one day. Just in the United States alone, we're going to have over 10,000 people die. That's coming. If you remember in April, we had like over 4,000 die per day in the United States alone, like after Easter. Um, and we didn't even have that many cases compared to now. So now that we have all these cases and the conditions of those who have COVID will get worse and worse, you can imagine we could easily have 10,000 deaths. I'm thinking even up to 20,000 deaths per day or maybe more than that. That's what I'm predicting. And I think I'm accurate. I think that will happen because right now we have 120,000 new cases. And this is not the summer, this is the winter. So people who have COVID will have much higher chance of dying. So that's very, very unfortunate. That's why you should protect yourself by staying inside, socializing just with your family. If you want to socialize with others, use the internet or Skype. That's the way you can socialize safely with others. But physical distance is a problem with COVID-19. As you can see from the image graph below this video, COVID-19 is airborne, meaning particles stay in the air. Um, so even if you're across from the room, if there is somebody who has COVID, you will get it. That's the problem. Obviously, if there are 20 people in a room and nobody has COVID, obviously nobody's going to get COVID. But if there's one person with COVID, then people can get infected, right? Obviously, you're safe if nobody has COVID, but you just don't know. That's the problem, right? You just don't know. Um, so number one in Europe is Russia, and they have 1,740,172 cases and a 2% death rate, 30,000 10 people have died so far. So Russia's numbers have gone up significantly. They have the most cases, but now their death rate is going up and up and up. So if I were Putin, I'd start worrying. Um, France is number two with 1,709,773 cases and a 2% death rate. They have 40,220 deaths. Spain is number three with 1,328,832 cases. And at 3% death rate, they have 38,833 deaths. So you can see like all rank 5 countries in Europe, they're similar. They have between 30 to 50,000 deaths. Most of it from March and April. So now they're heading toward massive death. Um, and I'm predicting that there will be millions who die in Europe by June. We do not have a vaccine. We do not have cure. So obviously, it stands to reason that a lot of people can die, right? Once the condition starts getting worse. United Kingdom is number 4 with 1,174,770 cases and at 4% death rate, 48,978 deaths. So in Europe, United Kingdom has the most deaths so far. It'll be interesting to see if they will continue to be number 1 in deaths or not. There are a lot of deaths in England right now, and the death rate is rising. So maybe they should have a stricter national lockdown than what they have now. Italy is number 5 with 902,490 cases and a 6% death rate. 41,063 people have died. So the percentages are lower because of the summer. But during the winter, they had like 10%, 12% death rate. So that's coming, certainly in April, but even before then, probably starting in November and May, November through May. You see why we can have millions of deaths in Europe? Because deaths are going to like spike up suddenly, and then people are going to keep dying. And you won't be able to control it. Nurses will die, and as nurses die from COVID, hospitals will have shortage of nurses, which will result in even higher number of patients dying. So that's coming. It's going to all happen at once. all over everywhere, and you will have no chance to control it because there's going to be nurse shortage everywhere. People, dead bodies, we may have to prepare crematoriums right in the middle of the city, just burn body after body. We will not be able to keep up. So that's coming. Yeah, the weather was pretty nice today. It was like in the 70s. Unfortunately, the weather was nice because if it were cold, people would not be like socializing. But because the weather was nice, a lot of people were just like in the downtown area of DC, just kind of singing Sweet Caroline, blah, blah, blah. I forgot the lyrics to Sweet Caroline. Um, so, I'm sure a lot of people got infected today all over America, which is unfortunate because that's how COVID-19 spreads when you are really close to each other like that. Like if the person you're close to doesn't have COVID, there's no problem. But you don't know who has COVID and who doesn't have COVID. That's the problem. So who knows how many people got infected today, right? Like in cities where people are gathering together closely together. Um, it's a worry because a lot of people can die. You see how concerned Leo is? Leo is very concerned. Yeah, it is a worry because COVID-19, we're having like 120,000 cases. And in the flu season, we're going to have 10% death rate. So 12,000 are going to die minimum once we hit that traction, flu season traction of 10% death rate. New York City had like 10% death rate in April. So we're going to hit it. New York will hit it again. New Jersey will hit it again. It'll be like deja vu for them. They could be number one and number two for COVID-19 death in America again. I'm projecting that 1 million people in New York would die from COVID by June. And I don't think I'm overestimating because if you have been to New York, I had a business in New York. I had a learning center in New York, um, that I started my company. So I know New York well. New York is very crowded. People live in very crowded areas. So a lot of people can easily die. Um, and coronavirus can spike, just out of nowhere, and it will become uncontrollable. So that's what New York is looking at right now. Um, yeah, I don't think you should doubt that we're going to have 30 million, like 3 million people die by May. Because it only takes about 60,000 people dying in every state to have 3 million people die from COVID by June. Look, this is only November, beginning of November to be exact. So you have November, December, January, February, March. That's 5 months. So until March, we have like 5 months to go. And then we have April, May, June. We have 8 months to go. You don't think 60,000 people would die in every state in 8 months? Um, Look at the way the coronavirus is spreading in every state. Um, you don't think 60,000 people will die in your state, wherever you are, Maryland, Virginia, um, Pennsylvania, New Jersey. Well, New Jersey and Pennsylvania are going to be much higher. New York is going to be like over a million. But wherever you are, Utah, you don't think you will have like over 60,000 deaths by June? We have 8 months to go. We do not have a vaccine. We do not have a cure. We have 8 months to go. Um, yeah, we are in a very, very bad situation right now with COVID-19. Do not believe the liberal media when they tell you everything's going to be okay. Everything is not going to be okay. And everything will not be okay. We have 120,000 plus cases of COVID every day. And in the flu season, we could have like 10,000 deaths per day or more. How is it going to be okay? It's not going to be okay. The weather is nice today, which is unfortunate, right? It's nice when it's nice, but if people start mingling, then COVID-19 spreads. So it's a curse in disguise, right? It's not a blessing in disguise, it's a curse in disguise. Because if it were cold, freezing cold, people would not be outside. But because it was nice and warm, people were outside fraternalizing. And so a lot of people are going to get COVID tonight. A lot of people are going to get COVID. Yeah, so that's unfortunate for our nation because we already have 120,000 cases. As I said, Halloween will spike cases, and it did, right? After Halloween, we have like over 120 cases. Halloween parties and trick-or-treating, I told you it will spike the cases, and I was right. Before Halloween, we had like what, 80,000 cases. After Halloween, we consistently have every day like 120,000 or more. So we have an increase of like 50% of cases after Halloween, just like I said it will happen. Right? I told you there will be spikes of COVID-19 after Halloween. I told Arlington County to forbid Halloween parties and trick-or-treating, but they did. So now even in Virginia, I'm in Arlington County, we have over 2,000 cases. Virginia has spiked up significantly after Halloween, as I predicted. And as you know, I'm Heerak Christian Kim, candidate for U.S. Congress in Virginia's 8th District, which includes Arlington, Alexandria, Falls Church, and Fairfax County. And obviously, I'm intending to beat Tom Bayer 2 years from now and become your congressman. Yeah, unfortunately, many of you will be dead by then because we're going to have at least 100,000 people die in Virginia, unfortunately. Because there's no cure and there's no vaccine. If you get infected and the weather starts dropping to like freezing, a lot of people are going to get sick and die. And that's coming. You know it's coming. Weather dropping to like freezing weather, that's coming. So a lot of deaths are coming. And I'm predicting that all the hospitals in this area will be packed by November, this month. So we have like, what, 25 days to go? You think that's short? It's not that short. Obviously, before Halloween, we had 80,000 cases. Now, after Halloween, we have 120,000 cases. That's an increase of 40,000. So 80,000 increasing by 40,000. We have a 50% increase in cases right now. And 4 or 5 weeks later, we're going to have a lot of deaths. So do the math. We're going to have a lot of people dying. And it's very, very sad. Yeah, right now I'm going to focus on the East Coast. New York was bragging that it's not going to have many cases. It was wrong. New Jersey was bragging like they had no cases. It was wrong. I've always said, as you know, if you've been watching this show, and my show started on April 2nd, I've always said New Jersey is going to spike COVID-19 like it did in April. I said that all the time. New York as well. And I've also said New York and New Jersey will be rank 1 and rank 2 for COVID-19 death again. And you've heard me say that in this show. I still believe it. And now you're beginning to see the spike, right? Like New Jersey is like, oh, we only have a few hundred cases. Like that was a few weeks ago, right? But where is New Jersey now? And we have what? November, December, January, March, January, February, March to go, 5 months. And then we have April and May to go to June. We have 8 months to go. You know how many people are going to die from now until then? We have no cure. If you get it and the condition worsens, there is no cure. You can die. Obviously, but they'll put a tube down your throat to help you breathe with a machine ventilator. Um, but last year, like what, 25% to 50% of the people in ventilators died. So you may die, even with ventilator. It's going to be bad this year because COVID-19 has mutated. So it's kind of doing all kinds of weird stuff to your body, right? That it didn't do in April. So, yeah, it's going to be really, really bad. So let's read our first article. Pennsylvania confirms record-breaking daily COVID-19 cases. Over 4,000 reported. Can you believe that? Over 4,000 in one day. And this is by Staff 69 WFMZ TV today. And the significant quote from this article is the Department of Health confirmed as of 12 a.m. November 7th that there were 4,035 additional positive cases of COVID-19. 4,035 cases of COVID-19 in Pennsylvania in 24 hours. Can you believe that? At the flu season, death rate of 10%, 400 of them would die. Just in the state of Pennsylvania, 400 would die at the flu season, 10% death rate. Bringing the statewide total to 227,985. This is the highest daily increase of cases. According to officials, the number of tests administered within the last 7 days between October 31st and November 6th is 310,410 with 18,433 positive cases. After Halloween, we're going to spike. I told you that we were going to have a spike, and I was right. Of course I'm right. I'm the Leonardo da Vinci of 21st century. I'm going to be right most of the time, almost all the time. There are 9,015 deaths attributed to COVID-19, an increase of 40 new deaths reported, officials say. So even now they have like 40 deaths. 4 or 5 weeks later, they're going to have like 400 deaths per day or more. Yeah, it's going to be a serious problem for Pennsylvania. How about the state right next to that? Both of them in the East Coast, right? New Jersey reports 3,207 new COVID-19 cases. 3,207 new COVID-19 cases. It seemed like yesterday, a few weeks ago, that they had like a couple hundred. See how quickly cases can spike up? Because it's a person-to-person transmission. If you socialize, if you eat together, if you talk together, you can get COVID. That's why it's spreading so fast, because it's person-to-person infection. So, yeah, New Jersey reports 3,207 new COVID-19 cases. And in 4 to 5 weeks, the deaths are coming. Right now, it's 11 because it's like, it's still warm and, people still need like 4 or 5 weeks, 6 weeks to get sick enough to die. So at COVID-19, 10% death rate, you're going to have like 320 die. So combining Pennsylvania and New Jersey for 24-hour tally, You're going to have like 700 people die just from these two states in one day. Um, yeah, let's go to the body of the article. New Jersey officials reported 3,207 more cases of the coronavirus Saturday. The highest, Saturday's today, right? The highest number of new daily cases since April 27th, when the state was still in the midst of the initial outbreak peak, and 11 additional deaths. As I said, deaths are going to come, give 4 to 6 weeks. We're going to have like sharp spike in deaths. That's coming. Um, Governor Phil Murphy has said the state is getting hit with a second wave of pandemic and all but assure that new restrictions to try and blunt the spread of virus would be announced soon. New Jersey has to shut down. There's no other way. Look at this, 3,207 new cases. The weather is not that cold. I mean, if you keep the state open, it's going to be like 6,400 cases, 10,000 cases. That's where we're going. Um, yeah. Third article, Cuomo increases National Guard presence at New York airports to stop untested travelers from entry. Yeah, so New York knows it's headed to like over 1 million deaths from COVID-19. So it wants to prevent that or reduce it. And we can't really prevent that. People are going to get infected, people are going to die. You can't prevent the death, but you can reduce the death. So Cuomo is increasing National Guard presence at New York airports to stop untested travelers from entry. I thought it's important to read that again. This article is by Jennifer Millman for NBC New York. And the significant quote from that is Governor Andrew Cuomo said Friday he'd increase National Guard presence at New York airports to enforce new COVID entry test requirements ahead of the holiday season. So Thanksgiving is coming. Oh my goodness. Can you imagine what's going to happen after that? Oh my goodness. Yeah, we may go to like 250,000 cases per day after Thanksgiving. Um, yeah, I mean, we'll easily have 25,000 people die per day, like in December. Um, it's going to be horrific. As you know, I'm predicting that 10,000 nurses will die by Christmas. Because look at this, we have 125,000 cases every day. So out of that, at the flu season death rate, it's 12,000 people are going to die every day. Now we have Thanksgiving coming. So we could have like 250,000 cases per day, which means daily death rate could be 25,000. A lot of people are going to die. Do you see why we can easily have 3 million deaths in America? We're just doing simple math here. It's unfortunate there is no cure and there's no vaccine, and there's not going to be a vaccine for the next 10 years. There's not going to be a cure. It's kind of like HIV virus, right? They've done research long time. They don't have a vaccine, right? Hepatitis C virus, it's the same thing. I'm predicting that all the area hospitals will be packed in November. And that every hospital in this area will have at least 12 nurses die. Obviously, I don't want nurses to die, but they're going to die because nurses treat COVID-19 patients. So it's easy for them to get infected. And out of the people who are infected, the nurses who are infected, some will die, right? Just rational. So I'm predicting that at least 12 nurses will die in every hospital. So 12 nurses will die in Virginia Hospital Center. 12 nurses will die at Inova Fairfax Hospital by Christmas 2020. 12 nurses will die at Inova Alexandria Hospital. 12 nurses will die at MedStar Georgetown University Hospital by Christmas 2020. At least 12 nurses will die in George Washington University Hospital by Christmas 2020. At least 12 nurses will die at Children's National Hospital by Christmas 2020. At least 12 nurses will die at Sibley Hospital in Washington, D.C. At least 12 nurses will die in Suburban Hospital in Maryland before Christmas 2020. Tucky seems concerned. Tucky's concerned because there's going to be so many deaths before Christmas. Tucky's really concerned. You know, love is powerful, but love is not powerful enough to save you from COVID-19 death. Love doesn't win. When it comes to COVID, love does not win. You will lose a lot of people that you love to COVID-19 death. Love does not win with COVID. Yeah. Because COVID is not a human being. COVID doesn't want your love, doesn't care about your love. COVID-19 is a virus. So love does not win with COVID-19. Because even if you love COVID-19, COVID-19 can understand. Its function is to infect and kill. That's COVID-19's purpose for existence. So love does not win. Love loses with COVID. Love never wins with COVID. And that's the tragedy of COVID. Everything you are used to saying and thinking and believing doesn't work with COVID-19. You see what I'm saying? Love does not win. Love never wins with COVID. Because it's a killer virus. And that's the tragedy of COVID. You're going to lose a lot of your loved ones to COVID death. And that's the sad thing. It's very sad because you may lose your child. It's also possible that you could lose all your children. If you have 3 children, you may see all 3 of your children die from COVID. If you're a nurse working in a hospital, you may be the one who bring COVID to your children and infect them with the result that they die. It's a tragic time right now because COVID-19 is a person-to-person infection. So the person who's going to give you COVID will be another person, someone that you're close to. So do you see why it's tragic? Because if your children get COVID, it's probably from you, especially if you're a nurse or a teacher, right, who teaches in a school, in-person classes. You have high chance of getting COVID and high chance of dying from COVID. If you're a teacher in Alexandria City Public Schools, Arlington County Public Schools, Falls Church City Public Schools, Fairfax County Public Schools, you have high chance of dying if you teach in person, but you should thank God, and also you should thank me, because I worked 3 months very hard to close down Virginia's 8th district public schools. So thankfully, all 4 school districts closed. I did that to save your life, to save your children's life, because I care about you guys. That's why I'm running for U.S. Congress, because I care about you, and I care about this nation. I can save this nation from COVID. As you know, I'm an expert, clinical nurse leader, CNL. I was in a 2-year full-time program at Georgetown University from 2018 summer to 2020 summer. I graduated on August 24, 2020 with 24 other clinical nurse leader students. So I've been trained as an expert, healthcare expert, to help you survive COVID-19. There's going to be a summit. So there is an annual summit of clinical nurse leaders. And in the summit, obviously, we discuss issues that directly affect you, and we discuss how we can help you. Because we're healthcare experts, right? Um, so the summit is going to be in February. And obviously, because of COVID-19, it's going to be virtual. So I submitted proposals to present uh, papers or research. Uh, and I'll hear back from them like in December if my proposal is accepted. And if it's accepted, I will be delivering my research on COVID-19 at the CNL Summit 2021, which is going to be in February. So CNL stands for Clinical Nurse Leaders. So all the clinical nurse leaders from United States, because we have 50 states and then we have US territories. So there aren't that many of us. It's a very specialized expertise. So there aren't that many of us, but we have a summit every year. So the next summit is in February. And we are clinical nurse leaders. So we are horizontal leaders who coordinate patient care in hospital units. And we're trained to do that most effectively. So that's our expertise. Different nurses acquire different expertise. We are professionally trained to coordinate patient care to save the patient's life using multidisciplinary approaches. And we're one of a kind because we're basically the only ones who are focused, trained to have this competence or expertise. During COVID-19, obviously, CNLs are very important, more important than you can imagine, because of our expertise, right? Because different nurses who get masters get expertise in different areas. Our expertise is the clinical setting, dealing with you, the patient. That's our expertise. Coordinating care to save your life. Unfortunately, there aren't that many of us because it's a very hard expertise to acquire. So there are very few of us in the United States or around the world. There are over 4 million nurses in America, and there's only like, I think 10,000 or so clinical nurse leaders. And they're spread out everywhere. So you're very lucky and blessed. As Christians, we use the term blessed. That I, Heerak Christian Kim, have created this show, COVID-19 Update by Heerak, to keep you updated about what's going on with COVID. So you're very lucky and blessed. Yeah, because how else are you going to get the truth? Liberal media keeps lying to you, right? They said you're going to have a vaccine. You don't have a vaccine. Liberal media keeps saying you're going to be okay. No, you're not going to be okay. Most likely somebody you love will die. You may die. Your child may die. Your husband may die. Your parents may die. Your grandparents may die. Your cousins may die. Your brothers or sisters may die. Someone's going to die. So how are you going to be okay? You're not going to be okay. I'm not going to lie to you like the liberal media. I'm not going to tell you everything's going to be okay, because everything will not be okay. Like, how is it okay when your child dies from COVID? How is it okay? It's not okay. But that's what you're facing. Many of you in Virginia's 8th district will have your child die from COVID. And some of your children will die from other things like flu or common cold or RSV another virus. You know, in the flu season, people die, but with COVID-19, there's a higher chance your child will die because hospitals will be packed with COVID patients. So when COVID was not around, your child could get treatment in a hospital and survive. Now with COVID-19 patients filling the hospitals up, your child may not get the care, nursing care that he or she needs to survive. Yeah. So that's why it's going to be tragic this winter. Because you're most likely going to lose somebody you love to COVID-19 death or another illness, death from another illness like the flu, common cold, or RSV. You're going to lose someone you love. How is that okay? It's not going to be okay. You're not going to be okay after this winter. You're going to feel like you're no longer whole. You're going to feel like you're broken. Because after your child dies from COVID or somebody you love dies from COVID, you're not going to feel like you're whole. Obviously, you still have to survive, but I'm not going to lie to you and say everything's going to be okay because it's not. It's not going to be okay. This is important for me to tell you because if you live a lie, you may develop some kind of mental illness, right? I mean, you may develop some kind of psychosis. Um, you know, because you aren't expecting it. You are believing that everything will be okay. You're not going to live in a reality. That's how a lot of illnesses start, right? When you don't want to live in the reality. So I am going to make sure you're in the reality um, as a way to make sure that you don't have a nervous breakdown. I mean, obviously, you don't want your child to die, but you got to mentally prepare for that possibility, right? We're not living on a peaceful time. We're living in COVID time. So you should expect that to happen. If it doesn't happen, great. But you have to emotionally prepare for it, mentally prepare for it. Yeah, it's going to be very, very bad, and you're not going to be okay. Like by June, you're not going to be okay because somebody you love would have died by June. Somebody, you know, somebody you love. It's sad, but this is a period of global pandemic. What do you expect, right? I march for your life. That's why I created this show. I want you to survive COVID. I want your children to survive COVID. I want both your children and you to survive COVID. That's why I created this show on April 2nd. I march for your life. To continue on in the article, maybe I should start reading from the beginning. Governor Andrew Cuomo said Friday he would increase National Guard presence at New York airports to enforce new COVID entry test requirements ahead of the holiday season as he tries to fight back the state's biggest viral increase in months. I told you so. I told you New York will spike COVID, right? I said this when New York was having like few cases, like 100 cases or whatever. I said New York is going to spike. You should have believed me, right? I am Leonardo da Vinci of 21st century, so I am rarely wrong. Yeah. Um, Acknowledging the aggressiveness of the measure, Cuomo said, you should not land if you do not have proof of a negative test upon landing. I want people to know we're serious. While he did not provide details on how frequently travelers would be checked, the governor also said he had spoken with Mayor Bill de Blasio about enhancing NYPD presence to assist with the same. So in a sense, they're becoming a police state. It's an emergency situation, so you got to understand why that's happening. Um, but New York is headed to over 1 million deaths, so you kind of understand what's going on right now, right? They're mobilizing the National Guard in anticipation of U.S. spike in COVID, New York spike in COVID that could lead to like 1 million deaths. Um, Remember, this is only November, beginning of November. We have November to go. We have December to go. We have January to go. We have February to go. We have March to go. That's 5 months. Then we have April to go. We have May to go. We have June to go. We have like 8 months to go. Yeah, it's gonna be horrific. It's gonna be horrific. I just wanted to cheer for my cohort members at Georgetown University because I'm predicting that at least 5 of my core members will die by Christmas. Some of them are working in ICU, intensive care unit, where there's very big risk of death, COVID-19, getting COVID-19 and dying from it. And some people are fat, and some people have diabetes, some people have other conditions that can make them susceptible to COVID-19 death. Um, CNL 2020, CNL 2020, yay! We did it. 25 of us graduated. We started with 34 and 25 of us made it, yay! Yeah. What can you say, right? I mean, what can you say? Um, um, yeah, it's bad. It's really really bad. Um, I wish I could give you better news. I wish I could say everything's going to be okay. I wish I could say that, but that would be a lie, right? Right? If I say everything's going to be okay, that would be a lie. I'm not liberal media. I'm not liberal media. I'm not going to lie to you. You know what I'm saying? Liberal media wants to lie to you and think that it's okay. I don't think it's okay. Um, Lying to you. I mean, in a sense, you like people who are going to be headed to their death, right? Potentially from COVID. If you get COVID-19, you may be headed to your death. Why would you want lies? You see what I'm saying? Don't you want to know what you're facing, what you're looking at? Um, you know what I'm saying? I mean, there's no point lying to you because you're headed to your COVID-19 death potentially, right? In a sense, all of us can be like people headed to their death. Um, all of us have chance of getting COVID and dying. So that's for sure, right? Some of us will actually get COVID and die. Um, I don't think lying is a good way to go because why would you want to lie to a dying man, right? So I think it's important to tell you the truth because we don't know if you're going to be a dying man soon, a dying woman. Um, it's going to be horrific and horrible. You're going to lose somebody you love if you're a nurse. You may be the one who infect your children with COVID, and you may lose 100% of your children. If you have three, all three may die from COVID because you might have brought COVID to them. And that's the sad thing, right? Um, and if you survive COVID, you will have to live with that. But what can you do? This is a global pandemic, right? As I've said, if you are someone who have millions saved up, maybe you should take like 6 months off or 8 months off since you have millions saved up anyway. So you reduce the risk of your children dying from COVID, right? Um, the nursing is the most risky job right now in the world. There's no reason to put your children at risk if you have money. If you don't have money, yeah, I mean, obviously, you do have to pay your rent and food. Um, but if you have money and you have children, maybe you should take a sabbatical. I mean, yeah, it's important for you to save other people as a nurse, but if you have like three little children, you do have an obligation to your children as well. And if you have enough money, you should put your children first. I mean, that's what I think should happen. Obviously, you do what you want. It's your life. A lot of people are going to die. What can I say? A lot of people are going to die. Um, a lot of people are going to die by June 2020. Yeah, it's going to be absolutely tragic. Absolutely tragic. I don't think people in U.S. Congress are thinking about this reality that's coming very soon. You know how people can get. They don't really think about it until it happens. Um, but yeah, that's the problem, right? You should think about it before it happens. Um, what can you say? What can you say, right? Um, yeah, I mean, I hope you survive. Obviously, people who survive are people who take the precautions, right? It's just simple logic. Um, I mean, there are people who take risks to survive. I mean, that's possible. That happens. But it may not happen. You see what I mean? It could happen, but it may not happen. Um, but one thing we do know is that COVID-19 death is coming. COVID-19 death is coming all over Virginia. COVID-19 death is coming all over Washington, D.C. COVID-19 death is coming all over Maryland. Yeah, COVID-19 death is coming everywhere. Um, and there's nothing you can do to stop it. COVID-19 spread. What you can do is to try to prevent yourself from getting infected, right? Yeah, you can protect yourself by isolating yourself in your home. Um, Self quarantining. That is your best chance of survival. You know, it's science. The human race has experienced pandemics before, so we have a level of confidence on how you can survive. You have to self isolate, self isolate. So I'm sure no one wants to self isolate, but it's a question of whether you want to survive COVID or not, right? You have many months left, right? This is January, November. So until January, you have what? November, December, 2 months left. So you have November, December, January, February, March. It's like 5 months away. And then you have what? April, May, June, 8 months to go. 8 more months to go until summer. And it's not like it goes away in the summer. You see what I'm saying? But the rate of death would drop. Like in the flu season, you may have like over 10% dying. In the summer, you may have 2 to 3% dying. You see what I'm saying? So there is a difference, which increases your potential to survive. Um, yeah, but it's going to be bad. It's going to be bad. We're looking at a lot of COVID-19 death. Um, yeah. I also want to do a cheer for my cohort members at Virginia Hospital Center because, who knows, I mean, hopefully no one dies, but, I mean, it's being a nurse, I mean, there's a high risk of getting COVID. So it's possible some of us will get COVID in our cohort at Virginia Hospital Center. It's also possible that some can die right before Christmas. So yeah, so I want to do a cheer for my cohort members at Virginia Hospital Center. Virginia Hospital Center RN residency cohorts, yay! I don't know, I have to come up with a better cheer, but at least that's functional, right? Um, yeah. I hope that you'll be well and that your children will be well too. I'll bring you more important facts and data tomorrow for you and your children so you can survive COVID-19. So tune in tomorrow. For now, I'm going to bid you adieu. Bye.